why you should be wearing a mask. As I'm sure you're aware, we're in the middle of the COVID-19 pandemic. What if I told you that there was an easy and simple way that you could protect yourself, protect those around you, and have mild inconvenience to your wallet and your comfort of daily living? Today, I would like to inform and persuade you on the positive benefits of wearing a mask in public, as far as also adhering to other protocols. Information for today's speech comes from an article from the Lancet, an article from the BBC, and then just information from the CDC website and the World Health Organization website. We're going to jump into my thesis statement, which is wearing a face covering while in public is an easy way to greatly decrease the rate of transmission of diseases between yourself and others. So the first thing I'm going to bring up is a graph that has a little bit of information, a little bit of backstory on where we're at least as the United States. This graph starts at the beginning of March and goes to June 22nd, which was a few days ago, so it's already a little outdated. But, and within those, between June 22nd and now, which is June 27th, there has been new news that we're breaking records, but not in a good way. The past few days, consecutively, there have been increasing and new record highs of cases of COVID-19 in the United States, which is not a good thing and not as was anticipated a few months back. One of the things that we had anticipated was what I'm sure you've heard of is called flattening the curve, which was the idea that in the beginning we would have a rise in cases, a nice leveling off, and then a decrease in cases that would eventually level off down to nothing. And hopefully that would have stayed underneath the line that you can imagine would be up here, that was the total hospital occupancy. You don't want to overwhelm the hospitals, so the whole time you want to stay underneath that. But as you can see, somewhere right around June 15th, there was an uptick, there was a rise, which, granted, this graph stops on June 22nd, so that line is even higher now. So I'm going to try and explore and explain to you reasons that might be and possible implications of that increase in cases. An interesting fact that I read about, which kind of puts things into perspective, is that the United States has had roughly 25% of positive COVID-19 cases since the beginning it came out. 1 in 4 cases of coronavirus has been a United States citizen, despite the United States only having 4% of the world population. So that 25% versus the 4% kind of puts things into perspective on something that we're doing wrong. Obviously, there's a problem that's not being addressed properly here in the United States that is being addressed properly in other countries, because they have much lower rates, even though they might have higher populations. So, the next thing we're going to jump into is the positive benefits of wearing a mask, as I think that will kind of explain, a difference in the numbers. This picture that I have up here right now is from a study done by a doctor who had petri dishes of a substance that bacteria can grow on, and while wearing a mask and not wearing a mask, he sneezed, coughed, sang, and talked into the dish at arm's length away, to kind of demonstrate what substances might be being expelled in the form of respiratory droplets from his mouth while doing those activities. And obviously, as you can see, with no mask, there's lots of bacteria growing, and with a mask, there's practically nothing. What this shows is that a mask greatly decreases the amount of aerosol particles and respiratory droplets that come out of your mouth that are just in the air at arm's distance away. Obviously, the disease everyone's worried about right now is not a bacteria, so it wouldn't grow on this plate, but it's transmitted in the same way, and we can take information from this study in the same way. It can be thought of in the same degrees that it's not being spread whenever you have a mask. So the main benefit of having a mask is you're protecting others around you, which I feel is very important and somewhat noble, and that we should all think about. It's very important to protect not only yourself but your fellow Americans in this time. Another benefit is it also has a slight protection to yourself if someone else has the disease and they're around you. It's not nearly as big as the amount of protection that you provide to others while wearing the mask, but it's nothing, there is a difference. And finally, other benefits are that, especially now, masks are cheap and easy to come by. They can be made yourself, that you can buy them easy from other people that are making them. And they provide very little inconvenience at the cost, very little inconvenience, but at what cost? If you're protecting those around you, it shouldn't make that much of a difference when it comes to, how inconvenienced your day might be, because it shouldn't be very much compared to, you're not spreading a disease. So I hope you understand the positive benefits of wearing a mask out in public. So I want you to consider now the consequences of not wearing a mask if everybody didn't do it. As you can see from the graph that we had up there earlier, we're rising again, and I do believe that is in part from anecdotal evidence I myself have experienced, as I'm sure you have too, is that less and less people seem to be adhering to these protocols that we've had in the past, such as wearing a mask, social distancing, all the big things that we've been taught with how to deal with the virus. So if we continue on our current path, I do believe we will keep rising to the point where maybe hospitals become overwhelmed, which would not be a good thing. But there is something we can do, and that is continue on what we've been doing. As you saw from the graph, we did start to decrease, but then we started to rise again. And I think if we just go back to how we were doing, wearing masks, maintaining social distancing, washing hands, and just avoiding going out, if at all possible, I think we can have a much more positive impact and continue to decrease those cases. Yes. So, in conclusion, wearing a mask, again, will greatly decrease the risk that you pose of spreading disease to others, as well as providing a small amount of protection for yourself. And back to my thesis statement again. It'll be covering in public is an easy way to greatly decrease the rate of transmission between yourself and others. An interesting and important quote, I think, to take away from this that I heard while doing my research is that it's important that we practice selflessness in this time. Wearing a mask is not only to protect yourself, but it protects others, those closest to you, and even those that might not be close to you, but you're just passing every day. And it was put in the way that doing a small sacrifice, a small action, could have a very large impact if everyone was, selfless and was able to do their part. So, I hope you had a nice takeaway from this, and thank you.